Hello, my name is Annalie Martin, and today in this video I will be going over verifying the prescriber's orders and also the Hoyer lift. So when you're verifying the prescriber's orders, of course, first you're going to want to verify your patient. That includes things like asking the patient what their name, date of birth is, scanning on their wristband. You're going to want to check for allergies. You can assess their medical history for this. Sometimes if they'll put a wristband on, you'll be able to check to see if they have a wristband that states their allergies. But always, no matter what I learned in most of the videos is still ask the patient, just because you just want to get that, that validation from them as well. And before I give my patient a drug, you always are going to want to perform those 3 checks, which is going to be when you first pull it out of the drawer, you're going to want to verify it with the EMR. Once you take it out of the drawer, you're going to want to verify it with the EMR, and then like usually, like also when you're pouring the medication, you're going to want to check that again. And the last check is usually whenever possible. Usually, I read that it's usually the policy at most hospitals is going to be doing it at the bedside. So usually you're going to scan it right into the system at the bedside and just verify that order on the patient in the in the EMR one more time. So now with the dosage, this is really important because we are going to want to either be able to look up the dose beforehand before we give our medication to our patient, and make sure that it is a safe dose. Is it appropriate for what their problem is? If it's for high blood pressure, is it a medication that you would give someone for high blood pressure? So you're just going to want to be able to use your critical thinking skills and just and when in doubt, always we learned about it in clinical. There is a system we can look up any medication that seemed very helpful. So it's always important to just look that up and check any calculations that you do a second time, just to make sure that that your math is correct and that you're giving the patient the correct dose. So as for the route, if it does not specify, you are going to want to check that with the prescriber, because that is important, and you don't just want to just come up with that frequency. You have to check the time. Usually the most hospital policies is that you're going to do this within 30 minutes. So before if my patient was due for the medication at 8 o'clock, I would want to try to get that medication to the patient at 8 o'clock. And another very important thing is always check the expiration. Make sure that it is not expired, and that it just so you know that it is safe for the patient. So you're always going to want to check the expiration date before you give them any medication or IV solution, anything to a patient. So when it comes to being signatures, the orders must be signed by the prescriber. Sometimes if you're administering, say, like a patch, you'll want to put a little piece of tape that has the date and time. And in that case, you may want to put a signature there as well. So that's just another time where a nurse may need her signature. That's one example. Okay, so when it comes to the Hoyer lift, you're gonna want them to be flat. Now this kind of the method to do this kind of reminded me of just like when you're moving a patient, you have to put that sheet under them so that you can easily move them, the non-skid sheet. This video pretty well reminded me of that, because the patient you need to kind of have the patient turn over, get that under them, and then have them roll over and get it completely even under the patient. Now, so once you position this thing under the patient, you are going to bring the lift to the side of the bed. Obviously, you would need the rails down. You're going to want to have, depending on the weight of the person, at least a person on each side. So you're going to want to widen the stance of the base with a lever, with the lever, and then you're going to want to attach the straps. All of these Hoyer lifts, well, most of them seem to be a little different, but you're going to want to attach, usually it kind of crosses over, but you're going to want to attach those slings to the hooks on the frame. And now before you move the patient, you are going to want them to have their arms crossed like this. And then you're going to engage the pump to raise the patient about 6 inches from the bed, and then you will unlock the wheels, and you'll want to wheel the patient back, and position your patient like over the chair, and then you're going to want to just lower the patient and help guide the patient down to the chair. And then at that point you can disconnect the hooks. A lot of the time you can leave the sling on, leave them on while they're sitting. It's just so then when you have to move them back, you can just hook it right back on and use that. So now I did also learn that some of them are like operated mechanically, some are manual. So you will definitely want to become familiar with that specific machine. So what I gave you was just like a basic, just the basics of how you would use the Hoyer lift. Thank you.